Hey, we're here with Dr. Neil Smith of the Snore Shop. Doctor, good afternoon.
Good afternoon.
Or good morning, actually. It's the morning show.
Well, good morning.
We're not, it's really early in the morning here. We're in the Northwest Territories where it's bright 24 hours a day. We're talking snoring. Everybody's affected by snoring.
Absolutely.
Everybody's affected by snoring. Just ask my wife. What's the percentage of people that snore?
Over 40 years old is about 40% of men, and closer to 20% of women. And as people get older, the likelihood of snoring increases, and women eventually catch up to men somewhere around the 65 to 70 year age bracket. And by then, it's over 50% of people. So,
see, honey, it's not just me. You snore too. What percentage of people have sleep apnea? Well, first, let's go through what is sleep apnea.
Sure. Well, as I explain to patients that come in, there's snoring, which in and of itself is not really a health concern. It's simply a inconvenience, and more so for the person listening than the snorer. However, many snorers will have moments where they stop breathing, and if these moments of breathing cessation last longer than 10 seconds, we call those apneas. And repeated apneas, unlike snoring, are a serious health problem. They increase someone's risk of everything from heart attack to stroke, high blood pressure, diabetes, erectile dysfunction in men, and give you poor quality sleep, resulting in daytime fatigue, trouble concentrating, greater risk of motor vehicle accident, etc. And of those who snore, approximately 50% of people have sleep apnea, and that number as well goes up with age. So,
can women snore as loud as men?
Absolutely, absolutely. I've actually had a recent case where a woman was tested for her snoring, and she came in at between 80 and 90 decibels, which over a prolonged period, it was interesting because her spouse was with her, and I suggested that he get hearing tested, and he had hearing loss, which I suspect was actually attributable to her loud snoring. So it can get quite loud, and we call these people heroic snorers, even though their bed partners may call it something else. It's called heroic snoring.
Probably horrific,
Yes.
I would say. Heroic, very good.
Yeah.
Now, what are some of the treatments available for snoring and for sleep apnea?
You know what? There are a lot of treatments available. Starting with snoring, sometimes a change in position will affect snoring. Some people will even sew tennis balls into the back of their pajamas, and it'll force them to roll over on their side, or special pillows will sometimes turn the person over on their side. There are some fairly non-invasive treatments, such as, well, Breathe Right nasal strips will keep the nose open, and there's another device similar called sinus cones that you put up inside your nose, and some people that's all that's required. If it's more significant, sometimes some simple procedures done in the nose, and palate procedures work well as well to reduce the soft tissue in the back of the throat, and that will shrink and stiffen the palate. Dental appliances as well move the tongue forward, and by moving the tongue forward, it certainly helps with snoring. And then as you move into more moderate and severe sleep apnea, the two treatment options available are either a mask that you wear each night called CPAP, and that's CPAP stands for continuous positive airway pressure, pardon me, and what that does is it blows some air through your nose, pushes that airway back open, and prevents these moments of breathing cessation. And then there's what's called oral maxillofacial surgery, where the upper and lower jaws are moved forward, and that moves the palate and the tongue base forward, which creates a bigger airway in the back of the throat.
Now, you touched on it briefly, but exactly how dangerous can sleep apnea be?
Well, it can be quite dangerous. You know, years ago, you'd hear, oh, good old Uncle Frank died sleeping next to Martha. God love him, must have had a heart attack. Well, if he had a heart attack, he probably would have woken up and woke up Martha. So in its most severe state, it can actually result in nighttime death. My favorite football player was Reggie White with Green Bay, died of sleep apnea. And you frequently hear it among football players because they tend to be your bigger variety guys. So in its most severe state, it can kill you in your sleep. But even without being overly melodramatic, I mean, it increases your risk of heart attack up to about about 5 times, increases your risk of stroke between 3 and 5 times, increases your risk of high blood pressure, diabetes. Your risk of developing diabetes is actually 8-fold if you have sleep apnea. And it's simply because when your body's under stress, it releases a stress hormone similar to a steroid called cortisol. And that hormone stays around, elevating your blood pressure, playing havoc with your insulin levels. So your likelihood of developing diabetes or having hypertension actually goes up quite a bit.
So we know when people come here and get the treatments, they're going to be in so much pain and just crying and leaving bloody, and I mean it's a very painful, intrusive. Your life will never be the same when you come here because it's just going to be so horrible, isn't it?
It's pretty much carnage, yes. No, no, it's not like that at all. For those who end up using CPAP, many people feel like, oh my goodness, I can't imagine wearing something on my face every night. But what they figure out is very quickly is that these masks are quite comfortable, and the quality of their sleep changes so significantly that most will very quickly get used to the inconvenience of putting a mask on their face and going to bed. The other common comment I hear is, oh, my bed partner will find this horrific. I can't imagine that they would want me to wear one of these things. And it's anything but the case. Most bed partners will gladly strap it on your face before you go to sleep because they know that it means they get a better night's sleep, you get a better night's sleep, and it's good for everyone. Now the procedures that we do to reduce the soft tissue at the back of the throat, called radio frequency ablation, is quite comfortable. Patients who get it done, you will usually have a mild to moderate sore throat for 3 days. I'll do it on a Friday, and most of them will take it easy over the weekend. By Monday, their throat is usually back to normal, and within a week to 2 weeks, over 90% of patients will completely stop snoring. So that procedure as well is not overly traumatic, and most patients sail through it pretty well.
What's the worst case you've seen? Now, do you guys actually study people while they're sleeping, or is this something that you guys do? And what's the loudest one where you went, oh my God, that's horrible. How could anybody stay in that room?
Our monitors measure up to 90 decibels, and we've had more than a few people tipping the scales at 90 decibels. Beyond that, the monitor actually doesn't measure any louder than that.
Peaks.
Yeah, that's right. So we've had many people who spend the majority of the night at 80, 90 decibels. In terms of the severity of one's apnea, we've had patients with over 100 apneas an hour. We've had one, I had a truck driver I saw recently with 120 apneas an hour, which means that he's having 2 of these apneic spells where he stops breathing for more than 10 seconds. He's having at least 2 every minute. So he's basically not breathing as much as he's breathing. And I asked him, I said, well, how do you function? And he said, oh, you know what, I have my big Timbs, and he had like a big 2-liter jug that he carries in his big rig when he drives. And I mean, driving's a big concern with people with sleep apnea. There's also a misconception that people can lose their license if they have sleep apnea. And while that's a possibility, most people who come to see me want to get help, and most will accept the treatments, and they'll realize that they're fairly easy to accept, and they'll feel better as well. So I do see some bad sleep apnea and some quite loud snores.
So there you go. It's easy, simple, doesn't hurt, and you're going to get the best sleep of your life. Dr. Neil Smith, thank you very much for inviting us in. You have a lovely place here in the Northwest Territories. It's really early in the morning, but it's bright outside, and that's, we spare no expense. Actually, it's in Dartmouth. Come on over. Actually, give me your exact location and your hours.
We have a location at 35 Baker Drive, and we're open Monday to Friday, and we're also we're open Tuesday and Thursday evenings as well. And then we have another location in the Park West Mall in Clayton Park, by the Canadian Tire there in Clayton Park, and that's open Monday to Friday, and soon we'll be open in the evenings at that location as well.
Perfect. Thank you very much.
Thank you.
I hope you're paying attention because you might be quizzed on this. Thank you.